I'm Dwight Kelsey from Atlantis Physical Therapy. Today we are going to demonstrate several exercises for the low back that can help to decrease pain, increase flexibility and strength, and allow you to do your normal day-to-day activities easier and more comfortably. We've divided these exercises into 3 sections: stretching, strengthening or core exercises, and Swiss ball exercises. All 3 of these groups can be progressed from basic to more advanced. We ask you to start with the basic level and only progress if you can do them with correct form and without increasing your low back symptoms. You may want to consult with your physician or physical therapist before starting these exercises for your own safety. Lie on your back, hips and knees flexed, with feet flat on the table or floor. Grasp your right knee with your right hand, then your left knee with your left hand. Pull both knees toward your chest until you feel a stretch in your low back. Hold all stretches at least 10 seconds or 3 deep breaths. Place your legs back on the table one at a time. Repeat the exercise 5 times. You should increase the repetitions weekly. Lie on your back, hips and knees bent, with feet and knees together. Rotate your knees to the right, keeping your left shoulder pinned to the table. Hold 10 seconds, then repeat to the opposite side, holding your right shoulder to the table. Repeat each direction 5 times. To advance exercise difficulty, cross opposite knee over the other. Lie on your back with hips and knees flexed. Wrap the loop of the belt around your right foot. Straighten the right knee and pull the leg up toward the ceiling until a stretch is felt behind the thigh. Hold for 10 seconds or 3 deep breaths. Repeat 5 times. Perform the same routine with the left leg. To advance this exercise, add hold time for as much as 20 seconds. Lie on your back with hips and knees flexed. Wrap the loop of the belt around your right foot. Straighten the right knee and pull the leg up toward the ceiling until a stretch is felt behind the thigh. Hold for 10 seconds or 3 deep breaths. Repeat 5 times. Perform the same routine with the left leg. To advance this exercise, add hold time for as much as 20 seconds. Starting with the same position, raise the leg to the upright position until the stretch is felt behind the right thigh. Pump the hip forward and back 10 times, allowing the sciatic nerve to stretch at the hip level. Lower the leg. Repeat 5 times for the right leg, 5 times for the left leg. With your hands next to your shoulders. Press with your hands, extending your arms until your elbows are fully extended. Look with your head at the wall in front of you. Hold for 5 seconds. Repeat this exercise 10 times. To advance this exercise, increase the hold time up to 10 seconds. Assume the same position on your back as for the start of the stretches. Tense your abdominal muscles. Raise both arms straight up toward the ceiling. Lift both legs one at a time, forming a right angle at the hip and knee. Hold for 15 seconds. Return to the start position, lowering your legs one at a time. Repeat this exercise 5 times. To increase the difficulty, add time until you can hold the position for 60 seconds. Lie on your back with knees and hips flexed, arms straight by your side. Tense the core muscles in your stomach and low back. Lift your pelvis toward the ceiling, pressing downward with arms and feet, lifting the pelvis as high as you can. Hold for 10 seconds. Repeat this exercise 10 times. This is an advanced core strengthening exercise that should be performed only when undue difficulty or increased pain are not caused. Lie face down. Tense abdominal and low back muscles. Move arms forward so elbows are under the shoulders, propping on forearms. Raise buttocks off the table, forming a straight line between knees, hips, and shoulders. Hold for 15 seconds. Repeat 5 times. To progress, increase hold time up to 60 seconds. To advance difficulty, perform this exercise lifting the knees off the table and holding a straight line from feet to hips to shoulders. Use a large enough Swiss ball so your hips are level with or slightly higher than your knees while sitting. Sit with erect posture with arms extended, holding onto a stationary object. Roll your pelvis forward and back, keeping all the motion in the pelvis. Try to increase motion slightly with each repetition. Glide your pelvis side to side. All the motion is in the pelvis. Again, attempt to increase the motion each repetition. Move in a clockwise circle. Again, increasing the circumference of the circle each repetition. Repeat in a counterclockwise direction. Perform each movement 10 times. For increased results, increase the number of repetitions. Lie face down on a Swiss ball with your abdomen on the ball, spreading your feet apart for balance and maintaining a straight line posture. Torpedo, hold your arms at your side for 10 seconds. T, hold your arms straight out like a cross for 10 seconds. Superman, hold arms straight in front of you for 10 seconds. Repeat this cycle 10 times. To increase difficulty, increase hold times. There are many more exercises that can be performed on an exercise mat or Swiss ball. The ones we have demonstrated are basic ones that can be helpful to many, but not all low back conditions or individuals. Consult your physical therapist or your physician if you have doubts whether one or more of these exercises could be detrimental to your specific diagnosis. Our goal is to give you exercises that will lessen your low back pain. Again, if the performance of any of these exercises causes an increase in symptoms, stop. It probably is not the right one for you. Thanks for your interest. Look for more exercise videos from Atlantis in the near future. If you have any questions or need assistance, we are always here to help.